Hi, my name is Jerry Hesch, and I practice in Aurora, Colorado. And this is in a workshop that I'm teaching on the lumbopelvic hip region. And this is a physical therapy assistant who has 2 children and had traumatic pregnancies. And she believes that she had a rupture of the pubic joint. She's been working very hard at self-managing it and doing a pretty good job, correct? But you know that it's not quite right yet?
Yeah, it's still, something will still come out every once in a while, especially from running.
So when you run, you feel like there's a shift in the pubic joint?
Not every time. I can run just fine, but every once in a while, maybe every few weeks, I'll feel something. My psoas will get tight, or my lumbar spine will lock up, or the ankle pain will come from the pelvis. One of those. So.
And do you feel anything particularly with the pubic joint?
Only when it goes out.
And when it goes out, what does it feel like?
It's like a pop with a sharp pain, which then, the pain then goes away immediately, but I know it's out.
Okay.
And then I would have to put it back in. That doesn't usually happen from running though.
Okay.
But that does happen every once in a while, maybe every couple of months.
Okay.
If I reach wrong or step wrong on one leg.
Yeah, so when you're loaded and you put more weight on one leg,
Yeah.
that's often what causes you to feel it shift?
Mm-hmm.
Okay. Alrighty. And at your worst, how were you? There was a time when you were pregnant and you had to crawl around?
Oh yeah. So I was pregnant with my second, and when I think this ankle probably glided posterior, because that's kind of the symptoms match. But it was also very inflamed at the time, because one thing would go out or another. It was all very, very inflamed, and which is why it gave me so much pain. So after like a day of working, if I would come to lay on the bed, I would get this really severe pain that you can't roll, you can't kneel, you can't sit, you can't stand on both legs. To go to the bathroom, you have to crawl, like very, very slowly, because the pain was just so bad. And so to correct that, I'd have to put pressure until it goes back. But it is like a knife stabbing pain.
Incredible.
Yeah.
So glad you're doing a lot better than crawling around.
Yeah.
You're back to work full time.
Yeah.
Very good. All right. Well, I did some of the advanced spring testing with you on the pubic joint.
Mm-hmm.
And what I felt like was that there was a little greater excursion of the fibrocartilage than what I would call a normal.
Mm-hmm.
So I feel like you do have some hypermobility issues with the pubic joint. They don't seem to be severe, but it's more movement of the fibrocartilage in an AP direction than what I consider norm. I also found more movement on the right pubic bone in doing an AP spring than on the left. Were you able to perceive that?
Yeah, I think so. I mean, it's pretty tender, so that only means something must be going on.
So is it more tender on one side?
I don't remember that, but I know that the cartilage is definitely tender.
Ah, the fibrocartilage
Yeah.
midline is definitely tender.
Yeah.
Okay, so I'm filming, and so we found the top of the pubic structures to be symmetrical. We walked across and didn't find any step down. And now when I walk along the face of the pube at the tubercles, I'm allowing a 1/4 inch of space in between, and I'm feeling that I'm on bone on both sides. Now I come to the middle, now I come to the lower part, and now I'm walking across, and there's a little step down of the fibrocartilage. Did you feel that?
Yeah.
Can you tell there's a little step down?
It doesn't feel smooth, so
Okay.
I would, see
Alrighty.
this.
Well, I'm going to do an anterior to posterior spring. We already did the vertical test, the vertical spring test. I'm not going to repeat those, but I'm going to take up the slack, and that's about 5 pounds of force. I'm loading you very slowly, and now I'm going to spring you with an additional 5, and it moves and it recoils backwards. Do you feel that?
Mm-hmm.
Now I'm going to come onto the left face of the pubic bone, and I'm taking up the slack, and can you tell that's definitely more rigid?
Yeah, I can feel that, yep.
Okay, and now I'm going to try and spring it, and it does move, but it doesn't move a lot. Okay, so now I'm going to come to the midline. Now I'm on your fibrocartilage, and I'm doing an AP spring. So I take up the slack, and that just, even taking up the slack, it moves more than I would expect it to. I'll do a spring now. Do you feel that movement? Okay. So I feel like you still have some laxity there, but you also have a unilateral issue going on. Now, I'm not finding a positional issue, so I want to look at the sacrum, because the sacrum is connected to the pubic joint. The pelvic floor is a direct connection linking sacrum to pubic bones. Okay? So if you'll sit up and face me, we'll make sure you're sitting outside of that depression. Okay? And scoot over just a little bit more. And we already tested you. This is just a repeat of what we found a little while ago. So you're in sitting, so your lumbar spine is a little bit more towards flexion. I find the PSISs, and so I know that I'm at S2. My thumbs have about 1.25 inches space between them. I'm going to do a pisiform contact. I'm springing your right upper sacral quadrant, and it's a quick thrust. Okay? I cross over to the left, and I take up the slack, and I spring it, quick thrust. I come down to the left lower quadrant, and I can't move it. I'm doubling the force. There's no movement. I'm going to slide over to the right lower quadrant. I'm going to take up the slack, and I'm going to spring it, and the force goes through your body. So I'm naming this a sacral torsion. Okay, we could do more detailed evaluation, but this quick screen tells me that we have some dysfunction in the pubic joint and also in the presentation of a sacral torsion in which the left lower sacral quadrant is prominent and stuck. And that's the terminology that I find a lot clearer than saying a left rotation on a left oblique axis.
It's confusing.
It gets confusing because you stop and you go, okay, which way is that axis going? Which way does it start? Which way does it end? And I go crazy. So we know that you're stuck here, and with treatment we want to restore movement with an impulse PA spring to the left lower quadrant. We also want to reduce mobility in the pubic joint, specifically on the right side, and gain a little mobility on the left, and certainly reduce excursion of the midline fibrocartilage. So we'll stop filming now and we'll treat you.